My name's Callum Thompson. It's the 27th of the 3rd, 2021. Good start. And this is task 1 for the Humpback Whale Challenge. Hi Eric, nice to meet you. Thanks for coming down.
Alright, Callum.
So we'll start off just by running through some pre-screening checks, and we're going to go through a static postural assessment, functional movement assessment, and some range of motion and dynamic strength testing today. So that's going to give me a bit of an idea of some of the abnormalities that you might have, and we can include that into some corrective strategies in your exercise program to try and correct them and get you moving through the day a bit better.
Cool.
So nothing to be worried about with it. I know it sort of feels a bit awkward getting judged by it, but just relax. It'll be nice and easy. Important for future training.
Sounds good.
So starting off, we're going to start with the what's called adult pre-screening test. So just going to ask, your full name is Eric Edwards, was it?
Eric Edwards, yeah.
Yep. What's the date of birth, mate?
1st of the 1st, 1986.
Perfect. Male, of course.
Yep.
Have your medical practitioners ever told you you have any heart conditions or anything like that?
No.
Do you ever experience unexplained pain or discomfort in your chest while exercising?
No.
Have you had an asthma attack or required any treatment for asthma in the last 12 months?
No.
Do you have any symptoms of diabetes? Have you had anything in the past related to any diabetes, type 1 or 2?
No.
Any other conditions or anything that would may require some special consideration for your exercise?
I just a little bit of tightness sometimes in my shoulder. That's all.
Yep.
Yeah,
No problem.
that's
We
about all.
work towards that. How often do you exercise a week at the moment?
About 3 usually.
Yep. Perfect. Would you say they would be moderate, vigorous, high?
I do a couple of easy sessions.
Yep. So
Probably moderate sort of intensity, sort of sometimes a bit of light weights for
perfect.
about half an hour, and maybe some like cross training.
Perfect.
I'll do probably one good session a week where I might extend it out to about an hour
Okay.
and do a bit more sort of some interval runs and that kind of thing. So
Perfect. Okay, not a problem. And as you said, age was 30. Perfect. Male. Do you have any family history of heart disease?
no.
No. Do you smoke cigarettes at all?
No.
And we have got your height and weight, so that's all good there. Have you ever been told of high blood pressure or anything like that?
Never high blood pressure. No.
Are you taking any medication at the moment?
No. I did take Voltaren a little while ago just for a bit of stiffness in my shoulder, but that's all.
Not a problem. And you haven't been told, of course, of any high cholesterol, blood sugar, anything like that?
None of that. No.
Not a problem. Have you spent any time in hospital in the last sort of 12 months related to any injuries or surgery you've had?
No.
Obviously not pregnant, I hope.
Not that I know of.
Good. Diagnosis of muscle, bone, tendon, ligament, or joint problems. You mentioned through the shoulder there.
Yeah, the shoulder. I think it's just a bit of pain through bad posture. I think I did some work with physio a couple of years ago.
Okay.
So yeah, I sort of let that go to the wayside though. So maybe
Right.
we can work on that later. Yeah.
Very good information to know. That's great. Okay, well that wraps up the APSS. We'll get on to the personal fitness profile. So this is a good way of us basically mapping out your fitness career, what sort of exercises you like, what you don't like.
Yep.
And we can go from there. So you've got your name there, occupation, date of birth, it's fine. What are you wanting to achieve in the gym? Like the general fitness, lose a bit of weight, or what are you sort of thinking?
I'm kind of interested in, I think I want to do some adventure racing.
Okay.
So perhaps,
When do you want to look at doing that? What's your sort of goal of time with that?
maybe next summer, so considering this time of year, I'm thinking December, so that's about 9 months from now.
Okay, not a problem. Oh, that sounds achievable. We can definitely work on that. And in terms of training, what do you think you need to be successful? You know, like in terms of like pushing and motivation, or you know.
I think with the adventure racing, I haven't really done one before, but I like the look of it, and it seems to me there's a fair bit of endurance capacity
Okay.
that I need to work on.
Yep.
But also further to that, there seems to be like a lot of body weight types and functional strength.
Fantastic.
So I think that's what attracts me to it. It's a bit of a goal, but I think it's going to cover a lot of range of fitness.
Perfect. Yeah, not a
That's
problem.
where I need some help. I really don't know where to start.
Well, you're in the right place. That's a good start. Now we mentioned your exercise. We were saying about 3 times a week, and about 30 to 60 minute sessions.
Yeah.
And you mentioned the injury in your shoulder. We'll make sure to keep an eye on that.
Yeah.
A little bit about just your lifestyle. How active are you in your job through the day? Would you say sort of moderate, active, strenuous, light?
I'm not very active. That's why I want to partake in this kind of activity, you know, and get your advice on that, because I do a lot of sitting during the day.
Okay. And after hours, sort of?
Well, that's my 2 moderate sessions are normally half an hour because I'm a bit strapped for time.
Yeah.
The
Okay.
other one's during the week, and normally my longer sessions on a weekend where I've got more time.
Perfect.
So,
Right, not a problem.
but I'm willing to perhaps dedicate more time to training
Of course.
with some guidance from yourself.
Yeah, of course. How long do you normally sleep?
It's pretty broken. I get about 7 hours.
No worries.
Just with a little baby I've got, so
Yep.
sometimes I get a bit broken sleep, which affects
Yep.
my recovery a bit, I think.
In the past month, how often have you been so physically restricted by your health, like unable to perform your workouts? Would you say like never, once or twice, once a week, once a day?
I'd say probably once a week, really, because
Yep.
like I mentioned, I've got the little baby,
Yeah.
and sometimes with overtime at work, just not able to train. But
Of course.
yeah.
Yeah. What's your diet like? Reasonably sort of balanced diet?
I think
or-
I eat healthy, but I don't really
Good
know
work.
much about that as well. So maybe some advice down the track would also be part of.
Yeah, well, we
what I'm
can
looking
sit down
for, yeah.
together and do that. I probably don't think that we need to see like a nutritional specialist yet. We'll just sit down, maybe
Yeah.
closer to the training, we can sit down with a nutritionist and have a bit of a talk about getting a diet down pat. But
Yeah, that's
And
something
now-
I'm interested in learning down the track. Yeah.
yeah, so you're wanting to exercise just on the weekends?
Yeah, just maybe couples during the week, but
Yeah.
maybe some longer sessions on weekends.
Not a problem.
Build on what I'm currently doing.
Okay. And yeah, you mentioned the kind of fitness activities that you're interested in before, so we can incorporate a few of those
That's good.
into the workout. Well, that wraps up that one. Obviously, all this information is just stored at the gym and under locked information. So any of the information that we do share throughout this will be of your concern if we have to refer you on to a specialist or something like that.
Sounds good.
Very good. So